Dr. Coleman, can you tell me about the hip surgery that I'm going to be having?
So what you have is something called hip impingement. And hip impingement means that if you look at the hip joint, the hip is made up of a ball and a socket. So the ball is the top of the leg and the socket's part of the pelvis. And both the ball and the socket are covered in cartilage, which is the cushion that you need when you walk and run and do everything. So what you have is hip impingement, which means that when your hip was developing, you develop some extra bone here on the neck of the femur, such that you have a small bump there. So every time you flex your hip and rotate, this bump hits into the socket, and it really does two things. It tears the labrum here, and your labrum is a ring of soft tissue that goes around the hip joint, and then it also starts to damage the cartilage, and that's really the main issue. So what we do about this is we go into the hip arthroscopically, we shave down any extra bone that you have here on the neck of the femur, and then we repair the labrum by putting small anchors into the bone and stitching the labrum back down to the socket. And that procedure is done as an outpatient. It's done under regional anesthesia. It takes about an hour to do the surgery. You're on crutches for 2 weeks, partial weight bearing, and then gradually you increase your activity and your weight bearing. And it takes about 3 to 6 months before you really get through the whole procedure, through the whole operation.
So when you've had the operation, can you, in years, get back to doing full sports, normal life, basically?
That's a very good question. The answer is yes. As long as the cartilage is normal in your hip, once we've corrected the impingement, you should be able to get back to most activity.
Okay.
My name is Dr. Coleman. I'm a sports medicine doctor here at the Hospital for Special Surgery, and I specialize in shoulder, knee, and hip. I have a particular interest in hip preservation in the young athlete.